Why don't we go on to one more question, Don?
Sure. This one may be relevant for the medical doctors. There's a constituent on who has a daughter or a relative of some kind in any event that is on a lupus medication that is also used for the COVID treatment.
And I should point out that I've been pressing the administration to use the Defense Production Act to create more of that the drug, which I'll mispronounce.
Hydroxychloroquine.
Hydroxychloroquine. Thank you, Don. And so, but I don't know if the constituent wants to ask their question in their own words or whether Don Summary does it.
Adrian, you're on.
Hi, thank you. Yeah, my daughter-in-law takes hydrochloroquine, and I'm just wondering if anything is being done to protect people who have a prescription and keep people from hoarding it for off-label consumption. Because I understand it's getting hard for her to find the drug already.
I know there's an all-out effort to manufacture more of the drug, but it should be overseen by the federal government for the Defense Protection Act. I don't know. I don't know if that either of the doctors here have had any experience with patients.
I do. I have one who's on it for arthritis by her rheumatologist, and she couldn't get it for a few weeks. But now CVS's policy that they will refill anyone's prescription if it's a standing prescription before the COVID crisis. If it's a new prescription, they're going to really restrict those.
We also have town hall meetings with our medical staff in general. That's 1,000 doctors that we do once a week. And we have strongly advised any of our physicians in prescribing hydroxychloroquine as an outpatient for someone that may have COVID. We've advised them that this should only be used for inpatients and that it should not be used as a prophylactic, and it should definitely not be used as an outpatient, as it would, obviously take up medications from patients with lupus and other types of diseases that this is critical for.
Yeah, we need to manufacture more so that isn't a consideration, but I commend you and your medical staff that until we have a surplus of this drug, it shouldn't be given to outpatients in a way that would take away from those suffering from lupus, malaria, or other long-time users. At this point, we're going to go to a survey question. This is question A, and you can answer by pressing the keypad on your phone. The question is, should the federal government be the sole purchasing agent for scarce medical supplies and devices? So instead of every hospital in every state scurrying around the world and the country trying to get their hands on masks and whatever, should the federal government buy it all and then sell it to the states and hospitals? If you think the federal government should be the sole purchasing agent and eliminate the competition, press 1. If you don't think that's such a good idea, press 2. And if you're unsure, press 3. And I believe now is the time we should go to another one of our guests. And I believe it's let me see. Is it our councilman or our assemblyman who's next?
Adrin's next.
Adrin is next, and good. Hopefully, Adrin was on the line to hear the question. I believe was from Canoga Park about the EDD program. Adrin Nazarian is much older than he looks. He worked for me back in the 1990s for a very short for a while. Went on to be chief of staff to Councilman Krekorian, and then went on to represent the East San Fernando Valley in the California Assembly. Adrin, why don't you tell us what we're doing at the state level, and then particularly talk to us about EDD and the unemployment.
Thank you, Congressman. These days, I think I look a lot older than my age at this point. much for having me. Whether in person or by phone, it's always wonderful to join you in your informative conversations with our constituents. I wanted to just point out, obviously this issue has been impacting many different sectors, but I'm going to just focus on small business aid, unemployment, and aging, and then I'm happy to take any questions, always available to take questions through our office phone number, which I'll repeat at the end. I'll mention at the end of the call or at the end of my segment. Just want to start out by saying that this pandemic is a marathon, not a sprint. So the next few months will test Californians from all backgrounds on our ability to come together and support one another as we have been doing. But we need that continued, steady support because this is what the new siege looks like. We are under siege, but instead of it being an army, it's a virus. So a month ago, Democrats and Republicans united in unanimously supporting in a single day to pass legislation allocating $1.1 billion in emergency funding for increasing hospital capacity, cleaning schools, and protecting the most vulnerable from the disease. And then the governor went on and expended that and has gone on to expend about $6 billion more on top of that we have started reviewing as well. But more importantly, some of the things that we've been specifically working on and the government has been leading the initiatives on are state departments and agencies compiling resources in support of small businesses. GoBiz is an office located within the governor's office that has helped with California's iBank program, which has allocated $50 million to capital for small businesses with employees ranging from 1 to up to 750 employees. California Capital Access Program, otherwise known as CalCap, is a loan loss reserve program which provides up to 100% coverage of losses as a result of certain loan defaults. That's a program through the Treasurer's Office, and this is a program also that's been around for a while and for disaster mitigation purposes is a great source. Another program is the Office of a Small Business Advocate, which brings together small business support and resource centers to help businesses figure out which loans are the best for them and to develop resiliency strategies. Again, these are all programs that I'm happy to provide for you through my office or at some point of the call. Generally, the best source to go to is the COVID-19.ca.gov. That's a site that's been established through the governor, and it has a myriad of resources available. And if you are lost in there, feel free to contact my office.
And what would be that phone number, Adrin?
818-376-4246.
And with Adrin giving his phone number, I'll also give ours. Sometimes we're sometimes deluged with phone calls, but you can leave if nobody answers, leave a voicemail. We will get back to you within 24 hours, and the number is 818-501-9200, and we have an awful lot of information on the web page. We have a place to sign up for email alerts. We've got a place on the web page to tell us that you have a problem dealing with a bank or the SBA or any federal agency, and we've got information about our upcoming town hall. Our next one's May 5th, and that web page is bradsherman.house for House of Representatives .house.gov. So, Adrian, perhaps you can tell us about unemployment. Last town hall we had questions about gig workers and how they should sign up, and I believe there's perhaps a way to do it on the current EDD website, Employment Development Department website, but it's going to get easier on April 28th when they're going to design it better to cover the gig workers. And then in this in this town hall, we had a question about someone who was getting unemployment, and they wanted to know whether the extra $600 the federal government is funding is going to be part of that. A lot of questions about about unemployment. What can you tell us?
There is, and segueing into unemployment, one other point of information for job purposes that I wanted to pass on is the website onwardcaliforniaca.org. Onwardca.org. It's a new platform that connects displaced California workers with more than 70,000 job opportunities in industries. So bear that in mind. For those of you who may know people who need to get back on their feet, this may be a good opportunity. As for the unemployment, EDD has been working on putting together a whole new system. First of all, starting as of yesterday, April 20th, they have expanded hours at their call centers from 8 a.m. to 8 p.m. 7 days a week. They've basically taken over 1,300 state employees and have redirected them to increase staffing at the call centers so that they heard you loud and clear. This has been a big source of contention. They had not been able to return calls. In fact, they had cut down their hours of calls to, I think, only 3 hours a day because they were so overwhelmed. So with the deployment of the new employees, I'm hoping that that'll better address a lot of individuals' needs. And you said it, Congressman, the new system for the pandemic unemployment system will go live on April 28th. If you have applied, please go ahead and reapply again. It doesn't work against your first application. There have been
Adrin, that's for people that wouldn't get unemployment insurance under the regular system because they're gig workers or independent contractors. But on April, you said 28th, they can go on the new website and apply because the federal government's providing $600 for unemployed, not employees, unemployed gig workers and independent contractors.
Yes. And it's part of the regular unemployment benefit that they would be getting. It's not an additional check.
If you are a W-2 employee, the kind of employee that would qualify under the old rules as for unemployment, you should get one check, and it's the old check plus, or whatever the benefit used to be, plus $600. If you're a gig worker, an independent contractor, it used to be you got no unemployment insurance. Now you can register on April 28th and get the $600 a week.
And they are attempting to have the checks sent out within 48 hours of processing. So I hope that I am offering a commitment that EDD has made that they're going to be able to ascertain and maintain. So they've given every assurance that they will be. The other point also is that benefits can be...
Adrin, I've got to go on to some other things here. If you have a closing comment, that's good, but I've got to get in a few questions, and I got to get in Krekorian as well.
Of course. I just wanted to end it by saying that the benefits can be retroactive to weeks starting as far back as February 2nd of this year, depending on what the last day was of the individual's job. And that's it. I'm happy to answer questions on aging at the office.
Good.
Thank you.
And we had a RSVP section on our webpage where people could submit questions. We've selected one of these best questions from Carlos in Sherman Oaks asks, what is being done to refund or add to the funding of the PPP program, and will I have to apply again when the new funding comes in? The answer is we have provided an additional $310 billion. That's what the Senate voted to do. The House will vote to do that on Thursday. I expect it to be signed into law Thursday, and the money to start being lent out as early as Monday of next week. The loan application that has already been processed is enough. You don't have to apply a second time. If your bank or credit union has already accepted your application. I know a lot of small businesses, they applied and they said, hey, good news, we've got your application. Bad news, we've run out of money. That means you're in line, and I think things look pretty good for those who are already in line, especially if you've received an SBA, Small Business Administration number. If you have an SBA number, you should receive a disbursement of your loan within the next 10 days. So there's an answer on one of our RSVP questions. Now we're going to take a survey question, and this is another chance to enter your views using the keypad. And the question is, should U.S. citizen spouses of undocumented immigrants be eligible for the $1,200 per adult economic impact payment? If you think that U.S. citizens should get the $1,200, even if they are married to someone who's undocumented, press yes. One is for yes. If you think that they should not because they've married someone who does not have immigration status, then press 2 for no, and if you're unsure, press 3. With that, I believe we've got Councilman Paul Krekorian on the line. And
I am here.
And you've been working for us for a long time in the San Fernando Valley, first in the Assembly, and I believe you've been on the City Council for 10 years now. Time does go by quickly. In any case, maybe you can talk to us about what's happening at the city government level and on the ground in the San Fernando Valley.
I'd be happy to, Congressman, and thank you very much for bringing us all together. The San Fernando Valley has been really blessed to have the leadership of such extraordinary partners in the federal government like you, the state government like Assemblymember Nazarian, and it's really been important to have this partnership as the city has responded to this unprecedented crisis. As was indicated earlier, the County of Los Angeles has seen 15,000 cases, 663 deaths as of today. And as tragic and sobering as those numbers are, when you compare those numbers to any other large city in America right now, it really is an indication that our safer at home policies are working in Los Angeles. We have not seen the sort of horrendous challenges that New York and other places have had because people are cooperating, pulling together, looking out for one another in Los Angeles, and that's been really inspiring to see, and the results are there to see. The most significant challenge that this city has had, even before the coronavirus developed, was, of course, homelessness, and that challenge is even greater now. And so people are rightly concerned about the spread of the virus within our unhoused population. I just want to give you a little update about our immediate response to that. There are now 20 emergency homeless shelters that have been put up across Los Angeles, providing 850 beds at rec centers in our parks. We've also secured 1,000 beds at 15 hotel sites for use by our homeless population in Los Angeles. We've installed more than 300 mobile hand washing stations to encourage better hygiene. And in addition, in my district, we just opened the very first homelessness navigation center, which will allow our homeless population to have a place to go every day of the week where they can secure services and find their way into health care if needed, and bridge housing in addition. So when it comes to folks who do have homes, who are very concerned right now about whether they're not going to be able to make rent because, of course, for all the health impacts that the COVID virus has brought, the economic impacts have been at least as devastating for families across Los Angeles. And there's great fear by many many people who've lost their jobs, who've lost their income. So the City of Los Angeles enacted the strongest renter protection ordinance in the state of California, other than perhaps Oakland might be a little bit stronger. But during the time of this crisis, no renter can be evicted during the emergency period for the inability to pay rent for any reason that's related to this crisis: loss of job, loss of income, taking care of a family member, and needing to stay home, those sorts of things. Renters are not required to provide their landlord with any proof of their emergency related to the COVID-19 crisis. And anybody who can't pay their rent will have up to a full year after the emergency period ends to pay the unpaid amount. No renter can be evicted during this period for having additional occupants, for example, a family member who wasn't authorized by the lease. There will be no fault evictions and no Ellis Act evictions. So it's a very strong ordinance to protect renters. Many people have started asking, well, I'm never going to be able to pay that rent back, so why can't you just forgive rent for a few months? The city does not have the legal authority to do that, and that's really something that would have to be done at another level of government, so we just simply don't have the legal authority to be able to do that. I want to talk briefly about seniors in need, because many of our seniors here in the San Fernando Valley have relied on congregate meals, for example, in our senior centers. Since all of those have been closed to the public, all of the senior centers have been closed, we have increased the amount of meal deliveries. So anyone who'd like to sign up for meals can call the Department of Aging at 213-263-5226, or you can call 1-800-510-2020, and they will be able to help you find your appropriate senior meal program. Now, I mentioned the economic impacts earlier, and I'm so glad to hear your news, Congressman, about the restoration of the payroll protection funds. The City of Los Angeles enacted its own business emergency microloan program. At my initiation, we set aside $11 million for a microloan program to help our businesses stay afloat during the time of this crisis. We've also introduced a number of other business relief measures in order to take some of the burden off of our small business community while they're struggling, and also to increase procurement towards small businesses, so that when the city is investing money in all the various services and things that we're doing right now in response to the virus, we're making sure our small businesses in the community are benefiting from that spending.
Paul,
keep jobs going.
I need to cut you a bit short because we're going to lose this line in 6 minutes.
Then let me just say one last thing. My phone number.
Oh, absolutely.
My phone number is 818-755-7676, or you can reach me at paulkrekorian.org, and I represent the entire East San Fernando Valley. If you'd like more information about any of these programs, you can go to corona-virus.la.
And I want to point out that after we end this conference, you'll hear my recorded voice, and at that point, you'll be able to leave a message. Please leave me your email address, even if I already have it, and we'll keep you informed in the future. And whatever comments you make, I'm not going to listen to tonight because it's 11 o'clock here on the East Coast. I'm in Washington, where I can vote on the bill when we go into session. But I will listen to your comments tomorrow. Let's take one more question from the audience. I do want to point out we're doing this again 2 weeks from today. That's May 5th, and it'll be you can dial in at 7 o'clock, 877-229-8493, and use PIN number 13402. And the best way to reach me is through the webpage, bradsherman.house.gov. With that, let's take one more question, Don.
Sue in Reseda has a question for, I think, the medical doctors about antibodies and vaccine. Sue.
Yes. If someone, hello?
Hello.
Hello? Yes. If someone has antibodies, they're doing a lot of antibody tests right now, I know, on people, and some people don't have symptoms. Now, does this mean that they can still give the virus to someone else?
That is not completely known. The scientists working on the antibody test have cautioned over the weekend, they were interviewed, that we don't know enough about this yet. There's a precedent where you're antibody positive and still very contagious. HIV is the most famous example of that. So we don't know yet. And also there's an issue about false positives. There's a concern that there's a significant false positive rate, so that if you're positive, you might in fact be negative, and you can't be assured that your infection is gone and that you can't transmit. That is, we don't have a reliable way yet of proving that you can't transmit it, which basically means you're going to need to do social distancing. Even with the PCR test that the Congressman talked about previously, being negative just means you're negative at that moment. There's many tests in infectious disease where if you do it 3 times, 1 or 2 of the times are positive, but the third one's negative, or the 2 out of 3 are negative, but you still have 1 positive. So one test alone doesn't mean you don't have the disease, which goes back to...
Francine, if I can chime in, this means you need social distancing and you need masks for everyone all the time. There's no such thing as, I have the antibodies, I'm Superman, I can go charging in and can't be hurt. There's no such thing as, I don't have the symptoms anymore, so I can't possibly give the disease to anybody. There's no such thing as, I don't have a cough today, so I must not have the disease yet, so I'm absolutely safe and I'll come breathe on you. Whoever you are, anywhere in LA and the San Fernando Valley, no matter whether you had the disease, think you had the disease, are symptomatic, or not symptomatic, or post-symptomatic, or pre-symptomatic, you're wear the mask and stay at least 6 feet away from anybody you care about, which should be absolutely everybody.
You are completely correct.
What? Good.
You are 100% correct.
And now we did take a couple survey questions, so I want to give the answers on survey question A. Should the federal government be the sole purchasing agent for scarce medical supplies? 53% of you said yes, 26% said no, and 21% were unsure. On question B, and this was an overwhelming vote, should U.S. citizens who are spouses of undocumented immigrants be eligible for the $1,200? 85% say yes, 10% say no, 5% say you're unsure. At this point, I think we need to wrap it up. I'd like these calls to be longer, but our vendor is expensive, and if we go into overtime, more expensive. So join us on May 5th for our 4th Coronavirus Crisis Town Hall, 7 p.m., dial 877-229-8493, PIN number 13402, and for more information about the economic programs, about how to reach us for casework. And I want to point out, if you're a small business and the bank you usually work with isn't being helpful on this PPP program, we've got particularly some credit unions that are willing to be helpful. I've worked with the credit union movement for 23 years. I've been a strong supporter of credit unions, and now the credit unions and small banks are going to be particularly well funded for this second PPP program. So be in touch with, work with your regular bank, but if that isn't working, give us a call, and that number is 818-501-9200. Look forward to talking to you on May 5th. Thank you. Brad Sherman here.